Hi everyone, my name is Renee Long, one of the social media specialists and webinar coordinators here at the American College of Healthcare Sciences. And joining me today behind the scenes for all our technical needs is Dominic Aiello, the other social media specialist and webinar coordinator here at ACHS. And today we'll be hosting a webinar from our Master Lecture Series. Each of these lectures features an expert in the holistic health field from the ACHS faculty. And it's my pleasure to welcome you to today's Master Lecture webinar, Homeopathy Basics with Dr. Nolan Noska. Just a few items before we get started. You may have also noticed that your line has been muted. We are recording today's webinar, and this helps ensure we can clearly hear our presenter. You'll also notice that you have a control panel at the right-hand side of your screen. And if you have a question you would like me to write down for our Q&A at the end of the webinar, go ahead and type it into the questions box. Like I said, we'll have a Q&A at the end of the webinar, so if you have questions as we go, type them into the questions box at the bottom of your control panel. I will write them down and I'll read them to Dr. Noska at the end. If you have further questions that require a bit more research, please feel free to follow up with Dr. Noska directly at nolannoska@achs.edu, and we'll post that email address a little bit later. And he is happy to respond to all of your questions, but please just be sure to give him a little bit of time to get back to you. And now I'll go ahead and turn the webinar over to Dr. Noska, who will give a brief introduction and then begin the lecture. Welcome, Dr. Noska. You should now have control of the webinar.
Welcome, everyone. First, I'd like to thank Renee and thank Dominic with ACHS for doing all the behind-the-scenes stuff to make this possible. It certainly wouldn't have happened without their hard work, so I really want to appreciate them. And thanks to everyone who decided to attend today. Of course, if there were no people to attend, then there'd be kind of no point of doing the webinar as well. So thank you for all of you that showed up. And like she said, I'm happy to answer your questions in a timely fashion if they are more extensive than what we can cover in this webinar. Let's see here. Okay. So today we're going to be talking about some basics with homeopathy. But also the real application of using this medicine. So I chose this name, using energetic medicine in a toxic world, and we'll touch on it more later on today. But it's a really important point. I don't use that language flippantly. We live in a toxic world, right? I'm sure many of you, depending on what place you are as students with ACHS, some knowledge of that or some understanding of that brought you to the more holistic fields of medicine. And it's no more evident than in the world of homeopathy, because it is such a far cry from what we're used to seeing in the medical realm, right? It's about less and less, not more and more. We live in a bigger, better, faster, more world, and certainly American society responds to that, but homeopathy lives in the realm of actually less is more, and in fact so small that you can't even see it or detect it almost. It's working on a level that is beyond what we can measure with instrumentation that we currently have. So it is one of the things that is so primarily important for a toxic world, because it's something that small can actually get to the place where it can give the organism an advantage over all the toxicity that's coming into it. Okay. So some main topics that we're going to discuss here. I'm going to talk a little bit about constitutional homeopathy versus what I primarily use in my practice, which is drainage, which is sort of a colloquial term. It's actually biotherapeutic drainage, and I'll explain that when we get there. I want to talk a little bit about how these types of remedies, these types of medicines work with other natural therapeutics. Maybe many of you listening have a very nominal understanding of homeopathy, or maybe no understanding of homeopathy, but maybe you know herbs really well, or something in that realm, or flower essences or aromatherapy. And homeopathy is one of those things that falls right into in line with those modalities. It's just another modality. It can work very well on its own. It can also work very well with other natural therapeutics, right? And then, of course, like I touched on, I'll keep coming back and back to where these modalities fit in our toxic world and why we may want to think about using them more, simply because of where we're at in society. Okay, a little bit about me. I am a naturopathic physician. I got a degree from the National College of Natural Medicine in Portland, Oregon. There is extensive homeopathy training as a part of getting that degree. Being a naturopathic physician does not make you a homeopath. They're not the same thing, but homeopathy is one of the modalities that I had extensive training in as a component of my medical degree. But it was mostly based in constitutional type homeopathy, or at least that's what I studied, and that's what my board exams were centered around. I did additional training as a student and in postgraduate years with renowned naturopathic physician Dixon Tom, who is a very successful naturopath, but also a dentist. And he's been practicing for over 40 years, and I worked with him in biotherapeutic drainage and using biotherapeutic drainage as a component of chronic disease management for patients. Dr. Tom is certainly one of the lineage holders for this medicine in America, and certainly America on the West Coast. Most of the work that he has brought here was an offshoot of the writings and teachings of Gérard Guignot, who is he's since passed. He was a French MD who really took many of the things from biotherapeutic drainage and brought them into the real world. It's an older medicine in the sense that it started in the early 1900s, and he sort of modernized it in a way in the 60s, 70s, 80s, and Dr. Tom sort of took some of that and has carried it over in an American sense. And there are other doctors, of course, in America that use biotherapeutic drainage and are part of this sort of lineage piece beyond the works of Dr. Guignot. So I'm going to talk about the basics from my education, but I'm also going to add my own philosophy of treatment. I think one of the things that is special about the holistic fields of medicine is that you can imbue, the practitioner can imbue their treatment with their own philosophical notions and things. How I treat is different than how my cohorts treat, and that's okay, right? I can't treat every patient, and neither can they. So the patients that really need me find me, and that's how this whole thing keeps spinning around, right? Okay, so let's talk about constitutional first, and some of you, may be taking my homeopathy course right now, or you've taken a homeopathy course in the past, and there's a lot of confusion, right? So I want to clear a few things up and straighten it out immediately. Strict or true constitutional homeopathy, from the sense of how Samuel Hahnemann set things out to be, starting in the late 1700s, has a very clear set of tenets, right? Things that define how you use the medicine to treat patients, right? And these laws are, I guess I would say they're immutable, but the term homeopathy is thrown around a lot, and it doesn't always mean the same thing. So sometimes people say homeopathy, and they may be referring to exactly what I'm pointing to here, constitutional homeopathy, or they may be referring to something completely different that's not that. So constitutional homeopathy abides by these laws, and there are many doctors who treat only through these laws, right? Only treat with these laws in mind, and that's their guiding principle. I would say that I'm not really one of those doctors, but I'm happy to discuss the merits of all ideas here. So let's look at these laws a little bit more in depth and find what it is that they actually mean.